Welcome to New Hampshire's Business. I'm Fred Coker. There's a widespread and skyrocketing shortage of healthcare workers in New Hampshire. Take a look at this graph, which shows the shortage in several jobs in New Hampshire hospitals. The blue bars show vacancy rates in 2019, the red bars in 2022. From left to right, all registered nurses, then registered nurses in ICU, licensed nurse assistants, medical technicians, and respiratory therapists. The shortages for New Hampshire home care workers has forced some home care programs to decline services. This shows a survey of New Hampshire home care providers that were forced to decline services and the percentage of them who had to do so shown in the dark blue part of each bar for 2018, 20, and 22. Very high, or around 90%. That's the bad news. The good news is there's a statewide plan in the making to develop and recruit a healthcare workforce, 2 years in the making, with 60 stakeholders and 107 strategy. With me to talk about this and to restore the healthcare workforce in New Hampshire are two individuals leading that effort. Polly Smith, Director of Southern New Hampshire Area Health Education Center in Raymond, and welcome.
Thank you so much.
Margaret Frockhauser, the Director of Aging Services at the Community Health Institute in Bow. Welcome.
It's a delight to be here.
Margaret, you and Paula and others have been traveling the state, introducing the plan. What's been the response?
The response has been overwhelmingly positive. And I think the reason for that relates to the data that you showed, Fred. Everyone knows how urgent the situation is, and it got worse during the pandemic. What is remarkable about this effort is that it is a coordinated and collaborative effort of every level of healthcare: hospitals, home care, community-based services, behavioral health. They all participated in this, so that with this report, we're rowing in the same direction together, because if we work together, we can leverage our strengths and bring in revenue and support for these programs in a way we wouldn't have been able to do working independently.
How is it being funded?
Well, it's being funded right now by the Endowment for Health through the Forward Fund. The Forward Fund was created after the Joint Underwriters Association folded, and they directed this pot of money to help support the New Hampshire healthcare workforce and develop it going forward.
Okay, thank you. Paula, this is an ambitious effort. What are some of the key New Hampshire groups working on this?
Well, one of the groups is the AHEC system. We have a number of shovel-ready efforts to address the workforce shortages that you highlighted. We have things like the AHEC Health Career Catalog, which is an online and printed resource that highlights health careers and schools in New Hampshire that people can attend. We also have middle and high school summer camps and a residential camp called the Health Career Institute at Dartmouth. We have longitudinal health careers and STEM enrichment for high school students. And our hope is to expand and share curriculum with K through 12 schools so that you can learn about health careers at earlier ages.
Of all your 107 strategies, are there one or two that are most important right now that will make the most impact in the short term?
I think the pipeline programs are really key. We need to work with youth and underemployed workers to see themselves in a health career.
This is an initiative I trust it will take years to put into effect. Most of it, that is, very quickly. Could you both say something to that?
Absolutely. It will take years to flush out all of it, but there are many pieces, and Paula's referred to them, that are starting right now. And I'll add to that one of the important pieces in the pipeline recruitment and retention is this recognition that people can enter at one point in healthcare, perhaps as a licensed nursing assistant, and then build their career, become a registered nurse, later become a nurse practitioner. So we can do things today that help develop New Hampshire for tomorrow.
Well, I want to thank both of you, Paula Smith, Director of the Southern New Hampshire Area Health Education Center, and to Margaret Frockhauser, Director of the Community Health Institute, for this briefing on their plan to fix the healthcare workforce shortage in New Hampshire. My thanks. If you missed part of this briefing, you can go to WMUR.com, where it will be posted later today and all this week.